Good afternoon. First of all, I have to apologize on behalf of the president of the National Institute of Intellectual Property of Brazil, Mr. Octavio Brandelli, who hasn't been able to travel to Argentina. As a matter of fact, he was very close to the airport when the Minister of Health called him in and asked him to stay or to go to Brasilia to hold some important meetings. As you know, Brazil has just had presidential elections. Right now there are many changes, and this is normal after an election. So the president of our institution stayed in Brazil after being asked to do so by the Minister of Health. I'd like to thank the organizers, ISA and ISACS, through its executive director, Minister José Gómez Temporao. I'd also like to thank the Ministry of Health of Argentina. I'd also like to say that I'm really very pleased to be here representing INPI from Brazil at an international meeting like this one, dealing with a very complex subject matter, which is also very strategic for all the countries, whether it's developed or developing countries. These two fundamental rights, which in Brazil are constitutional rights, the right to health, the right to free initiative and private property, which includes intellectual property, is a huge challenge. And I don't think this is the focus of the meeting, so I'm not going to talk about each of those rights. I'm not going to do so. But I'd like to stress that being an international advisor, as I have been an international advisor to the president for several years, I've been participating and keeping an eye on international discussions. And this issue has been the subject of heated multilateral, bilateral international discussions, because most of the countries want to guarantee access to health care for the populations, and they are also willing to take the necessary steps to guarantee this access. But at the same time, they want to protect the rights, the intellectual property rights, which are an incentive for innovation in processes and products. There are some treaties which have already been mentioned, but I'd like to mention them again. The TRIPS agreement of the WTO says that the members, when amending the rules or regulations, may adopt the necessary steps to protect public health and nutrition of their population, or to promote the public interest in areas that are of vital importance for the social and technological development of their countries, provided this is compatible with the international agreements. The Doha Declaration on the TRIPS, which acknowledges that TRIPS should not be used to prevent the member access to take measures to protect public health, and especially they should be used to promote access of medicines for everybody, using the flexibility provided or established in the declaration. The Millennium Development Goals of 2001, which talk about improving mother health and also improving everything related to HIV, AIDS, malaria, and other diseases, and also wants to grant access to essential medications at affordable prices for developing countries in the cooperation with the pharmaceutical companies. We also have the Universal Declaration of the Rights of Man, which says that all human beings have the right to have protection for their material and moral interests that keep them or give them the right to protect their intellectual, moral, etc. rights. And also the WIPO, among its 45 recommendations, says that the goals of the United Nations should be supported within their countries, including the Millennium Goals. And finally, this global strategy on public health, innovation, and intellectual property of the WHO, which acknowledges that the intellectual property agreements include flexibility should improve access to sanitary products in developing countries. As I have said, Brazil has developed its health policy based on the facilitated and universal access to public health by the population, especially in everything related to treatments for serious diseases such as AIDS, malaria, and others. So much so that the AIDS program from 1980, if I'm not wrong, was so important and its impact was so large that it had an impact on our state policy. Brazil, or the administration, also wants to incentivize local production of generics by setting up national laboratories, research and development centers, and creating partnerships with the private sector. Partnerships for development, for productive development, so as to reduce the dependency on foreign supplies or foreign R&D, improve our local capabilities, and reduce the cost of medication and medication acquisition. It's important to say that in Brazil, science and technology policies, as well as the industrial policies, they are all aligned with the health policy. And as a result of this alignment, the industrial health complex was set up, whose aim is to include in its objectives in the area of health, science, technology, and development by coordinating the activity of several programs and organizations of the federal government in order to create an economic and institutional environment or scenario that fosters development. I believe that the industrial health complex is a group or an organization that involves several public agencies and ministries, and the INPI among them. Therefore, and this goes hand in hand with our state policy, INPI has prioritized the way it analyzes the applications for patents for products and processes of interest that have been identified by the Ministry of Health. The administration is working really in an important way to increase INPI's productivity and to foster domestic innovation. And now, talking about industrial property and how INPI operates within this system, the administration has realized it was necessary to give the INPI the necessary means and tools to analyze patent applications in an efficient and quality-based fashion. And in order to improve its capabilities, it also had to improve its capabilities to communicate to the possible users of the system, of the national system, the knowledge about the way the system operates, the industrial property system works, and its impact, and also facilitate access to information, to technology information included in the patent documents, the patent applications which are pending, because this information is usually state-of-the-art information that could be used for new processes or product developments. Despite all the efforts carried out by the administration, the current scenario INPI, the current situation of INPI is quite serious. The time to analyze a patent is quite long. It's 2.3 years, and 75% of requests are analyzed for 10 years or longer. It's actually 12 years to analyze a patent application. Besides our legislation, the industrial property legislation includes an article, Article 40, which states that the term of the validity of a patent should not be shorter than 10 years. So, if we take an example, that 12 years it takes us to grant a patent for a drug, eventually the patent will be granted for 2 years more. As you all know, the consequence of this extension is quite serious. It's very expensive for society as a whole because it prevents the access of similar concurrent generic drugs to the market. In the case of drugs, this extension is really a serious problem. It affects access to medication, to affordable medication. And from the point of view of the government, it also has an impact on the government purchases of medication. So, what are we trying to do? What have we been doing? Ever since the president of INPI took office in early January, he made a diagnosis of the situation. And after this diagnosis, he suggested to the administration a plan. He submitted a plan to reduce the backlog. Backlog means a number of pending applications or applications that haven't been analyzed yet. And this plan includes three main objectives. Increase significantly the number of experts analyzing the applications, and this is the most important area, but it's also the toughest one because in Brazil currently we face unfair competition from the private sector, which offers, and I'm sure the same thing happens here in other countries in the Southern Cone, because the private sector pays better salary and offers better working conditions, so they hire the best researchers or researchers who might be examiners for our patent office. So today it's not easy for us to attract or hire examiners, and it's also difficult to retain them once they are in our payroll. There is another point which is very important too, which is investing in IT. And I'm certain that this would improve the speed of the process. And it would also create legal certainty because it reduces the number of errors or mistakes. And finally, improving and optimizing the processes, administrative processes and procedures, clearer guidelines that are easier to understand. And this would have a direct impact on the legal certainty or the guaranteeing of the legal rights. With all these steps, we expect that after some time, which is not a very short time, unfortunately, we expect to reverse the trend by which the backlog kept on increasing. The first step would be to go back to 10 years of analysis. This would take us back to comply with Article 40. We would also like to encourage the use of the system through strategic access to technology information included in the patent applications. This is a lot of work. We need to we need INPI to do advocacy vis-a-vis all the governments. You know, the intellectual property is a cross-cutting theme that is under several ministries. So as it's a cross-cutting element, it's complex from a technical point of view, very sensitive from the political point of view. So it's hard work which we are facing, but we are really hopeful that in some years' time we will be able to reverse the current scenario. Thank you very much for the opportunity of addressing you. I apologize for speaking the Spanish of Brazil, and I hope you have been able to understand me. Thank you very much.